So recently we initiated a pilot project, and it was really to fill a void that we've been struggling with in our organization for a long time. That it's the understanding of how our decisions impact our patients and our organization, and that struggle really is specifically around data. So we created a strategy to develop this pilot that would deliver real, meaningful, relevant data to our stakeholders and our decision makers. And we wanted to do it in a way that it was in a single platform for them to use. And we wanted it to be done in a way that if it was successful, we could extend it to other procedures or other service lines.
We joined forces with our orthopedic team and with an anesthesiologist here at McLeod Health, Dr. Rose. And our goal was to pull data from numerous systems into one tool where we could see the complete continuum of care for our hips and knees. We had a system that supply chain would use to look at procedure cost from a supply standpoint. We had another system that looks at the quality side of those procedures, the outcome side. And then we also had a system that was looking at the reimbursement. And so none of those systems talk to one another. And so our goal was to pull all of that information together for each patient, each procedure, each physician, so that we could look at those procedures and see if an initiative that we did for cost savings, did we see the results of that cost savings? If we changed any products on a procedure at all, did we see any change in the outcome?
So Dr. Rose, who is our leader of our innovation program here at McLeod Health, he put together this collaboration of stakeholders and subject matter experts around the orthopedic world, around supply chain, value analysis, our outcome and quality departments, our finance and cost accounting departments, as well as the organizational leaders that play a role, in this space.
So there's a pretty compelling problem statement involved in total joint surgery. Total joint surgery, one of the most phenomenal care lines available in terms of outcomes for patients. So 1 year later, people that will describe the surgery as having been life-altering for them, having substantially improved their quality of life, have substantially reduced their pain, have substantially improved their functionality. So that's what we were. So what we were confronting was an incredibly valuable service in terms of care, value to the patient of the care. We were doing it quite well clinically with very low variability, but we were really in a squeeze with cost. And we were really in a conundrum of, could we afford to diminish our investment in the implant technology as one of the ways to underpin the financials and not erode the care? And so that really became the challenge, the problem to be solved. Valuable care to deliver, a cost reimbursement formula that became very suppressing to the line. Could we alter those financials without putting the outcomes of the patient at risk?
So he engaged this group, and we did engage a third party to help us create a platform that would bring all this data into one place and to integrate that data in a way that's meaningful for our decision makers and our operators. So the ultimate goal really was to create that dashboard, make it as close to real time as possible in reference to data, so that our decision makers can drive value for our patients and our organizations.
Our supply chain team members began to work with SupplyCopia to develop a perioperative dashboard that would give us insights into physician behavior and use, and also to look at their clinical outcomes in comparison to their cost. And the SupplyCopia tool enabled that work by allowing us to drill down by physician to look at the specific items included in their procedures, to identify the cost associated with those items, and then to look at their clinical outcomes through our safety and quality data and present it to us as a consolidated report.
We wanted a dashboard that we could look at and that would integrate utilization, costs, revenue, and outcomes. And the last thing we wanted to do was implement a change in vendor or a change in product that was detrimental to our patients, no matter what the cost is. That was off the table, but we had no way of monitoring that. We didn't know, or it was too difficult to coordinate all that. So what SupplyCopia came and said, well, if we were going to develop a dashboard for you, what things do you want to see on it, and what data points do you want to monitor and follow, and how can we do that? I think one of the surprising things is how difficult it was to get all the data that we needed. Unfortunately, some data is in one computer system for supply chain, some data is in another system for RCM, revenue management, another one in for what we actually do for the medical record, and accumulating that data took some time.
So in reference to the data, we really tried to tap into all of those respective platforms and pull the meaningful data out of there to put it into one place so we could get a more complete picture. So we pulled data, like I said, from our ERP. So that's our item master, our PO data, all the way down to the detail of item descriptions and unspec categories and things like that. We pulled the consumption data from our inventory point of view system. So we know exactly what was used on what patients at what time and what room and by which doctor. And then we also enhanced that with our quality and outcomes data and also our financial data. So we understood the full picture of how all that played into our revenue and our total contribution and operating margins.
And for the outcomes, we built in two mechanisms. One mechanism were measurements of the outcomes that a health system typically used to define quality. So if you ask a health system, what's a quality operation for total joint surgery, how many people got readmitted? How many people died? How many people had a complication? What was the length of stay? Did the length of stay go beyond the average length of stay or not? And then to that, we added the patient-reported outcomes. And what SupplyCopia was able to do for us is to take on the health system outcomes. They helped us create a composite score made up of mortality, morbidity, length of stay variation, and complications. And so you can now begin to picture what that dashboard looks like. Here is our number of cases that we did this year, number of cases we did last year. Here is the quality composite this year. Here's the quality composite last year. When we initiated supply chain interventions and began to alter product usage, here's what happened to our costs. When we were altering costs of the implants as a focus, what were happening to the costs of the associated items? Because often those things are two different dials, and you could, if you got too focused on the implants, you could also miss an enormous opportunity or even counter it with the other materials.
What SupplyCopia was able to do for us is to blend all that into one single report so that we could begin to look at it along a procedure DRG basis, be able to determine what our actual cost per procedure is by physician and what those clinical outcomes that result from the procedures.
In the supply chain area, I think we've learned a couple of really important things. One is that the choice of the vendor makes a difference, and it's an important factor in the cost. No question about it. However, what we learned from this experiment is that factor alone cannot make the line sustainable, which is to say you can't take enough expense out of the implant to make this line profitable and is unlikely to ever be that way.
I'm most impressed with SupplyCopia's building and the way they have looked at our cases to be able to tell us that for any DRG, here are the construct or the components that go into that construct, and they can speak to quickly with the tools that we have what's the variation in those procedures. And so we're able to look at surgeon A to surgeon B, C, D, and E, and so on, and to be able to tell that of all these surgeons, here are the normal items that go into that procedure.
All the physicians went through like their surgery pack. Some of us had all these extra stuff, and do we use it all the time? No, but it's in there in case we need it. And then others had the minimalist pack, and then the nurses would pull stuff off the shelf as oh, we need this, we need this, we need this, we need this. So we tried to standardize that the total knee pack contains all this, and that will cover 85 to 90% of cases.
That was one of the things that we wanted to be able to see in the data was, did we maintain our standardization goals and our formularies that we as a group with the physicians decided that these are the things we're going to use and these are the things we're going to do? Did we stick to that, or did we have some variances, some variables?
So having a system that is now able in a highly granular way, able to understand and visualize the bill of materials, and SupplyCopia was able to show us the expected bill of materials. They were able to show us the bill of materials that were things that were used that were not planned. And then they were able to show us things that were used that were not part of, let's say, our joint RFP process. Beyond that, there was a huge opportunity in items and things used that were not planned for, and then being able to give visualization to items, including implants that were used that were not part of what was expected for the case.
The dashboard itself has a page for each physician, so they have their own specific page. This is where we get to see everything in one view with respect to cost, quality, and outcomes. So a physician can log in and they have the ability to see, how much did this case cost me? How much was the charge to the insurance? How much revenue did we actually receive? What was the direct, indirect cost of that? And how does that translate into a contribution margin and ultimately the operating margin for those procedures? And then they can see that with respect to all of the demographics of their patients as well as their outcomes. So it actually takes all that information and then rolls it up into a single score to help them understand at a high level, how well they are doing in this space.
What SupplyCopia was able to do for us is they were able to create the supporting informatics architecture. First, they were able to very deeply dive into our supply chain, not only for the fundamental implants related to the total joint surgery, but they could also help us visualize all of the rest of the stuff that went into the cost of the care, including other materials in the operating room. They were able to give us the combinations of stuff that physicians used, and we had no visibility to that before.
That's one of the things that we've actually been discussing is, how can we take the data that we have today, knowing what our preference cards say versus what is actually used and done in the room, and how can we create a more accurate preference card or an accurate bill of material to say, this is what our data says you should use versus what you did use. And I think that helps us with pulling in or being able to see where our gaps are. What products are we using that we did not plan to use? Because that's where your biggest opportunity is going to be.
My opinion, as I've looked at SupplyCopia tools, is that SupplyCopia is generations ahead of what tools are available in the market today. The capability of these tools are the kind of things we dreamed about 5 and 10 years ago, and they're here today, and we don't have to wait another 5 or 10 years.